Do you know what keratoconus means? Well, like most of you, neither did I until today. And to discuss this and a lot more, we have a very interesting guest joining us today on the TAS Morning Show. We are here at the Muscat Eye Laser Center located in Shati Al Khurram for this episode.
Giving sight to the people is life-changing.
Joining us on the TAS Morning Show today is Dr. Juan Arbelaez, award-winning cornea and refractive surgeon. He is the acting medical director and associate scientific director at the Muscat Eye Laser Center. Dr. Juan, welcome to the Morning Show.
Thank you. Thanks for inviting me.
It's lovely to be talking to you today. And first and foremost, big congratulations to you. You recently had a paper published in one of the most important medical journals in your field, which is the European Journal of Ophthalmology.
That's right. Thank you.
Congratulations,
Thank
Doctor.
you.
And could you tell us a little bit about the research that you do and how important these publications are in your career?
Well, research is crucial in ophthalmology. The research and the publications that we do allow us to improve the treatments that we give to our patients. We evaluated patients with keratoconus, and the result with a new intracorneal ring segment that was designed for particular keratoconus patients where the keratoconus is not as usual.
Doctor, I don't think too many people are aware of what keratoconus actually is. Would you be able to simplify it and explain, for the benefit of our viewers, what are the symptoms and what should they be cautious about?
I'm glad you asked this because keratoconus affects a lot the vision, and there is a way to stop and prevent the progression of the keratoconus. So, as I said, the cornea gets weak and start bulging out. We can have some factors that predispose the patients to develop keratoconus, like genetics, so it runs in the family. Here is very common in the Middle East and in Oman. Something for the people who is watching this video that we need to keep in mind is that please never rub the eyes, because this can produce keratoconus and increase the severity of the keratoconus. When you have kids which are not seeing properly and are rubbing the eyes, bring them quick to the eye doctor so we can evaluate and rule out if the kid has keratoconus to stop the problem.
Thank you, Dr. Juan, for sharing that information on keratoconus. I'm sure many of us weren't aware of that. Now, Doctor, how difficult is it to get these research papers published in highly acclaimed journals?
Well, these journals are peer-reviewed journals, and most of the time it's around 4 people, experts in the field, who are reviewing and agreeing that the result was done in the right manner, and the result, the statistics used to analyze the data was also chosen adequately for this type of study. It's a long process, and it requires a lot of effort to get these publications approved. The impact of the journals is high, and each publication that is done in peer-reviewed journals and important journals gets a lot of attention. I have received the gold medal for the contributions in ophthalmology for some of the research I did a few years ago. This was an award by the Indian Society of Ophthalmology. Recently, the Ministry of Health also recognized me as one of the top researchers in Oman, which is something that encourages you also to move forward and keep pushing.
Doctor, you've been regularly presenting your studies and papers at the annual Refractive Surgery Congress. Now, I'm sure this has been a collaborative pool of information sharing. What has been your experience like, and what has been the major takeaway?
The European Society of Cataract and Refractive Surgery does an annual meeting. When you do research, you start sharing this research in the conferences, in the congress worldwide. This is one of the most important meetings in the field of refractive surgery. You learn a lot because you meet with a lot of experts who are sharing all the research, the work that they are doing, the studies that they are doing. So this also allows us to improve significantly the treatments that we offer to our patients.
Doctor, in all your years of practice, you've done numerous surgeries worldwide, nearly 50,000 surgeries if I'm not mistaken. Now, what type of surgeries do you do, and are these safe procedures?
All of the surgeries that I do are in this field. These include surgeries that you might heard before, like LASIK, femto-LASIK, PRK, trans-PRK. Those are laser refractive corrections, but also implantation of lenses inside of the eye, like ICL, intracorneal ring segments, and corneal transplants, among other surgeries.
The Muscat Eye Laser Center is a state-of-the-art facility. It uses high-tech diagnostic devices and world-class equipment. But doctor, usually people are very cautious when it is to do with any kind of treatment, especially with regard to the eyes. Now, why would people choose Muscat Eye Laser Center, and what is the specialty?
Well, I always tell my friends and my patients that it's super important to go to a place where you can trust. This is the reason why we went through different accreditation processes to increase the safety standards of our treatments, our procedures, our infection control in the clinic. Another reason is the experience. The clinic has been already around for several years with a very good record, and the treatments that we offer, the technology that we offer to our patients is what is available worldwide.
Now, Dr. Juan, being an eye surgeon is definitely a very challenging profession, but I'm sure it's highly rewarding as well. Why did you choose to be an eye surgeon?
Well, I come from a family of doctors. My aunt became an ophthalmology, Dr. Maria Arbelaez. Indirectly seeing her, going with her to surgery, going with her to the conferences. She's also a researcher and the role model that I followed. And giving sight to the people is a life-changing thing. It's you cannot imagine the stories and the impact that this has in the patients. It goes from getting a new job to be able to do some sports that they will not be able to do because the need of the glasses, for example, get their driving license. It's a life-changing thing.
Absolutely.
So,
Doctor, so what are your future plans in terms of research as well as in terms of the growth story of Muscat Eye Laser Center?
there is a lot of things coming. There is a lot of research going on with in a couple of multi-center studies that are involved, studies which we are doing with different doctors from different places in the world. So new things are coming, new procedures that we will be able to offer to the patients, new technologies coming to the clinic, a lot of exciting things that are coming soon.
That's wonderful, Doctor. Dr. Juan, it's been a pleasure talking to you. Thank you so much for joining us on the TAS Morning Show.
The pleasure is mine.
So how long has it been since you've had your last eye checkup? I'd suggest don't delay, because you never know, things can change in the blink of an eye. Thank you for joining us on the TAS Morning Show. Follow the Arabian Stories on all our social media handles to stay updated with the latest news.